Hi friends, I'm Dr. Aparna and welcome back to my channel. Today in this lecture, we will be discussing on an important topic that is trigeminal neuralgia. Let's get into the video. The contents of this topic are introduction, synonyms, types, etiology, clinical features, treatment and conclusion. We all are familiar with the term neuralgia. What is neuralgia? It is a sharp, shocking pain that follows the path of a nerve and is due to irritation or damage to the nerve. Let's see in brief about trigeminal nerve. Trigeminal nerve, it is a nerve responsible for sensation in the face and control of motor functions such as biting and chewing. It is the fifth cranial nerve. It has three divisions. The first is ophthalmic nerve, second one is maxillary nerve, and the third is mandibular nerve. The ophthalmic and maxillary division is purely sensory, whereas the mandibular division of the trigeminal nerve is mixed. That means it contains sensory and motor. Trigeminal neuralgia. Trigeminal neuralgia is defined as a sudden, usually unilateral, severe, brief, stabbing, lancinating recurring pain in the distribution of one or more branches of trigeminal nerve. I repeat, trigeminal neuralgia is defined as a sudden, usually unilateral, severe, brief, stabbing, lancinating and recurring pain in the distribution of one or more branches of trigeminal nerve. Most commonly, the pain radiates to maxillary and mandibular divisions. The synonyms of trigeminal neuralgia are trifacial neuralgia, tic douloureux, fother-grille disease, and suicide disease. It is called as tic douloureux because in some cases it is accompanied by a brief facial spasm or tic, and there is transport of sensation from face to brain. So it is called as tic douloureux. The other name is fother-grille disease because this disease is described by John Fother-Grille. It is also called as suicide disease because the pain will be so severe that patient wants to escape from that pain and he may commit suicide. So it is called as suicide disease. Types of trigeminal neuralgia. Trigeminal neuralgia can be grouped into two types. The first one is trigeminal neuralgia 1. It is also called as idiopathic or classical or typical trigeminal neuralgia. The second one is trigeminal neuralgia 2. It is also called as symptomatic trigeminal neuralgia. So, there is two types of trigeminal neuralgia. Trigeminal neuralgia 1 or idiopathic or classical or typical. And the second one is trigeminal neuralgia 2, otherwise called as symptomatic trigeminal neuralgia. Trigeminal neuralgia 1. It is characterized by the attacks of intense stabbing pain affecting mouth, cheek, nose and other areas on one side of the face. In most cases, it occurs due to the blood vessel pressing against the trigeminal nerve. Sometimes no underlying cause can be identified. The vast majority, that is 85% of trigeminal neuralgia patients are diagnosed with trigeminal neuralgia 1. There is no clinically evident neurological defect. In trigeminal neuralgia 1, we have to remember that it is characterized by attack of intense stabbing pain. It usually affects mouth, cheeks, nose and other areas on the one side of the face. It is due to the blood vessel pressing against the trigeminal nerve. Sometimes the cause is not identified. In majority of the cases, that is greater than 85% of the trigeminal cases, the patients are diagnosed with trigeminal neuralgia 1. In trigeminal neuralgia 1, there is no clinically evident neurologic deficit. Trigeminal neuralgia 2, also called as symptomatic trigeminal neuralgia, is characterized by less intense pain but constant dull or aching or burning pain. It can occur due to non-underlying causes such as tumor or multiple sclerosis. There is presence of abnormal neurological examination. In trigeminal neuralgia 2, the pain is characterized by less intense pain, but it will be constant, dull or aching or burning pain. It can occur due to the underlying cause such as tumor or multiple sclerosis, and there is presence of abnormal neurological examination. Etiology for trigeminal neuralgia. Trigeminal neuralgia can occur due to compression of trigeminal nerve root, primary demyelination disorders such as multiple sclerosis, infiltrative disorders of trigeminal nerve root ganglion and nerve, as in perineural spread of head and neck cancer, post-traumatic neuralgia, non-demyelinating lesions of pons or medulla, and familial tendency. The etiology for trigeminal neuralgia are compression of trigeminal nerve root, primary demyelination disorders such as multiple sclerosis, infiltrative disorders of trigeminal nerve root ganglion and nerve, as in perineural spread of head and neck cancer, post-traumatic neuralgia, non-demyelinating lesions of pons or medulla, and familial tendency. Clinical features of trigeminal neuralgia. Older adults are commonly affected by trigeminal neuralgia than young persons. The disease seldom occurs before age of 35 years. Females are commonly affected. The right side of the face is affected in more patients than left by a ratio of 1.7:1. The pain itself is of scaring, stabbing, or lancinating type, which many times is initiated when patient touches a trigger zone on the face. Any portion of the face may be involved by the pain depending upon which branch of the fifth nerve are affected. In the early stages of the disease, pain is relatively mild, but as attacks progress over a period of months and years, they become more severe and tend to occur at more intervals. The early pain has been termed pre-trigeminal neuralgia and is sometimes described as dull, aching, or burning, resembling a sharp toothache. Later, the pain may be so severe that the patient live in a constant fear of an attack, and many patients have attempted suicide to put an end to the torment. Each attack of excruciating pain may persist only a few seconds to several minutes and characteristically disappears as promptly it arises. The patient may clutch his face as if he is in terror of the dreaded pain. The patient is free of symptoms between the attacks, but the occurrence of the painful seizures cannot be predicted. In the clinical features, we have to remember that this disease is mostly affecting older people, that means greater than 35 years of age. Females are most commonly affected, and the disease is occur unilateral. That means only on one side of the face. Usually the right side is more affected than left. The characteristic of pain is scaring, stabbing or lancinating type, and many times it is initiated when patient touches a trigger zone on the face. In the early stages, the disease is very mild, but as the disease progresses over period of months and years, it becomes more severe and tend to occur at frequent intervals. The early pain is called as pre-trigeminal neuralgia, and it characterizes pain as dull, aching, or burning, resembling a sharp toothache. Later, as the disease progresses, the pain becomes more severe and tend to happen frequently. In between the attacks, the patient will be asymptomatic. Trigger zones. The trigger zones are areas which precipitate an attack when touched. They are common on vermilion border of the lips, ala of the nose, the cheek, and around the eyes. Usually, any given patient manifests only single trigger zone. The patient learns to avoid touching the skin over the trigger area and frequently goes unwashed or unshaven to prevent any possible triggering of an attack. In some cases, it is not necessary that the skin actually be touched to initiate the painful seizure. Exposure to a small breeze or simply the act of eating or smiling has been known to precipitate pain. Treatment of trigeminal neuralgia. One of the earliest forms of treatment was peripheral neurectomy. It is the sectioning of the nerves at the mental foramen or at the supraorbital or infraorbital foramen. The injection of alcohol either into a peripheral nerve area or centrally into the Gasserian ganglion. The patient may experience respite from all symptoms for a period of 6 months to several years after alcohol injections. The injection of boiling water into the Gasserian ganglion has also been reported to be beneficial in causing respite from pain. Surgical sectioning of the sensory root of trigeminal nerve. The use of phenytoin in management of trigeminal neuralgia has been found to be efficient in some cases. The use of carbamazepine is also effective. One of the newest management is microsurgical decompression of the trigeminal root. The treatment of trigeminal neuralgia involves peripheral neurectomy. That means it is the sectioning of the nerves at the mental foramen or at the supraorbital or infraorbital foramen. Next is the injection of alcohol either into the peripheral nerve area or centrally into the Gasserian ganglion. And next is the injection of boiling water into the Gasserian ganglion. Next comes the surgical sectioning of the sensory root of trigeminal nerve. Medicines such as phenytoin and carbamazepine is also effective in treating trigeminal neuralgia. In this section, we have discussed about the definition, types, etiology, clinical features, and treatment of trigeminal neuralgia. I hope this video will be helpful for you. Please do subscribe to my channel and click on the bell icon so that you will be notified when I upload new videos. Thank you.